Thanks very much, Sam. Now we move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Good afternoon. Can I just check, did you say no longer will you be reporting on low-risk places? Is that's now not going to be reported by you to the public? Can you confirm that?
Yeah, just to confirm, we are in lockdown now, Paul, and therefore people won't be going out to areas. We will obviously be telling everyone about high-risk venues, but people should presume, and the minute they see any symptoms, they should be automatically calling 111 irrespective of whether they've been. But I'm sure Dr. Hewitt will put it over far better and more succinctly than I have. Dr. Hewitt.
Thank you, Chief Minister. I'll try. The key issue here is that if you're identified as a person who is likely to be a high-risk contact, we would not and never have put that out, as a press briefing or publicise it on the website. We actually go direct to those people. Now, as the Chief Minister has said, with circuit breaker, most venues aren't going to be options to have been in anyway, thinking of, hospitality and so on. That clearly leaves other ones, such as workplaces, which again, we would usually do on the basis of who are the high-risk contacts in there. If the workplace has been properly socially distanced, got appropriate working from home policies in place, it shouldn't really go beyond that. And there shouldn't be very many of them, even within the high risk bit. So that's not going to be such an issue. In terms of the casual contact, low risk type venue, were you in Tesco's at such and such time, etc. The issue there, as Chief Minister has said, is that actually with community transmission, all of us are at risk all the time of being infected. And therefore, rather than worrying about were you in such and such a place at such and such time, what you need to be thinking of more is, have you got symptoms? And if so, contacting 111 for a swab and self-isolating while you wait. Thank you.
Okay.
That's what I was going to get to, because obviously it could be shops, because obviously in the lockdown the shops are still open and therefore there could be a risk, but we won't know about it now, even if it's low risk. Correct?
The shops are socially distanced now, which they weren't before, which takes that element of risk to a mitigation. And the result of that is that after careful deliberation on this, we concluded that actually it's far better that everybody remains persistently vigilant, because we're all at risk all the time, rather than actually getting people to focus on venues and potentially coming away with a false reassurance.
Okay. My second question is about schools. Obviously, we're hearing from you that this is definitely a place of interest now with the younger generation. I know the key workers, you said, are going to be segregated more with some social distancing. But isn't there a case now for doing these rapid lateral tests or something like that on the key worker children every day? And especially, obviously, there's some jitteriness with the teachers because of the exposure that they may be getting. Is there not some way of giving a better snapshot and finding those cases out sooner rather than later?
Well, before I bring in the Minister and then Dr. Hewitt I know it's one of her favourite topics is these rapid tests. We do offer tests to all teachers who are working in the hubs first and foremost, whether they are showing symptoms or not. That is there for them. So with that, I'll hand over to Alex, who might want to expand, and then Dr. Hewitt on the her opinion on these fast lateral flow tests.
Yeah, but Paul, that's a very good question. Obviously, in the United Kingdom, they've reopened schools completely, or that's their hope, during a pandemic, and so they've brought in home testing for children using lateral flow tests. Now, we've discussed this previously. Lateral flow tests are useful, but they're not a yes or no. They're just taking a result at a certain period of time, a snapshot, and also their efficacy is quite low. It's around about 60%, looking at the various studies that came out of Liverpool. So by depending on those in terms of getting your child into school is fraught with problems, because they don't actually say that child is safe the following day or even on that day that they've had the test. What we've always relied upon on the Isle of Man is PCR testing, which is far more sensitive, far more effective. And actually the swabbing techniques, rather than having a parent have to do it, which can be very difficult with your own child, we use professionals who are trained in swabbing to do that. Now, as the Chief Minister has said, we have expanded the access to testing for any asymptomatic teacher or person who works in a school to provide that. We are not bringing in mandatory testing for students at the moment. What we're trying to do is control the number of students going into schools. We are in a circuit break lockdown to try to get on top of this situation. And when we can then open up, obviously we'll be looking at various testing regimes. And I know that Dr. Hewitt's been looking at the latest research in terms of lateral flow testing and also mass testing. But I must stress that at the moment what we're trying to do is control and eliminate the virus on the Isle of Man rather than move towards mitigation, which is the case in the United Kingdom. So I don't know whether you'd like to comment on that, Dr. Hewitt.
Thank you, Minister. That's absolutely right. So I definitely agree with everything you just said there. The issue is the difference between elimination and mitigation. I think obviously as we move forward and as the vaccination programmes complete, we will be having to review our position and ultimately coming to an arrangement that allows us to live with the virus in the long term. And at that point, it may be that the use of these lateral flow tests may become relevant in certain settings and certain groups. It certainly looks as though the accuracy of them is improving as we get into sort of second and third generation versions of these tests. And in fact, I was discussing that with laboratory colleagues earlier this afternoon. So it's something we're definitely keeping under review and that we will be looking at, I think, to see what place it may play when we get to more of a mitigation approach. But at the moment, while we're trying to get back to elimination, for the reasons that Minister Allinson has just clearly gone through, they don't add anything to our current approach. Thank you.
Could I just finish by saying, how often do you test teachers? Because you said it's a snapshot, so you'd have to do it every day, wouldn't you? You can't be doing that.
No, it's a voluntary basis. It's if the teachers feel they would like a test that's there, it's not every day, to the best of my knowledge. Alex, is that correct?
That's very true. I mean, obviously, if somebody's symptomatic, absolutely test them. But what we've done is try to respond to some of the concerns of teachers and other frontline workers, whether they be in health and social care or other fields, that if they want to have a test done for reassurance, particularly because they're concerned about taking something back to their household, we will provide that as much as possible. But what we're not doing is routinely testing everyone, because as you say, a test today that's negative only gives you that snapshot in time. It doesn't say that you're going to be negative for the rest of the week. And so that's why we're trying to emphasise the need for people to stay at home, to reduce the numbers of children actually going into schools, so we can get on top of this situation as soon as possible.
Thank you, Paul.